Hi, welcome to the lung page. Today we are going to discuss some MCQ points, two MCQs for each session for final year MBBS medical students for exam preparation. Especially we are going to focus on respiratory MCQs. Okay, this is part 1. So, okay, we'll go to the questions. Question number 1. Which test is considered the gold standard for measuring lung volumes? So we all know the question's answers are A. Spirometry, B. Body plethysmography, and C. Peak flow meter, D. Diffusing capacity. So what is the answer? So pause 1 second and consider your correct answer and comment below. So okay, we'll see one by one. In the spirometry, we all know this is basic lung volume measurement. It is measured only FEV1 and FEC. Okay, so here we can't measure the total lung capacity or residual volume. In body plethysmography, okay, so answer is body plethysmography. So in body plethysmography, we all know it will measure the total lung capacity, residual volume, and expiratory reserve volume, inspiratory reserve volume, everything you will measure. It's like a box body volume capacity. So we'll see the answer explanation a little bit. And also peak flow meter, we all know it will measure only the at the moment how quickly he will expirate. So we will measure only FeV1. Diffusing capacity, only it will measure the how this oxygen diffuse from the alveoli to blood. So answer is body plethysmography. So we all know, so this is how the body plethysmography measured. So this box, and also it will measure. So it's the principle is mainly Boyle's law, P1 B1 equal to P2 V2. So this test take place inside the airtight glass vault booth. So we consider as a P1 B1 outside equal to the P2 V2 in the lung. Okay, so the gold standard method to identify the inside gas inside the thoracic cavity. So clinically it will it will measure the total lung capacity, residual volume, and functional residual capacity. Everything you can measure from this body plethysmography. Okay, now you can clear. We'll move to the next question. So diffusing capacity for carbon monoxide, or otherwise we can call DLCO, is decreased in all except. So otherwise the question is, in what are the condition uh, DLCO is decreased or other than that? So I think this question is very clear. So what is the answer? So answer is here asthma without airway remodeling. Okay. So first we all know what is DLCO. So why we are using for this DLCO. So we'll see one by one. So here we can know DLCO and KCO. It's clearly I put this diagram for the explanation. Diffusing capacity of lung for carbon monoxide. So we give the carbon monoxide to the lung to identify whether this carbon monoxide diffuse to the blood. So here DLCO is mainly depend on the transfer coefficient. Okay, how well the oxygen pass from the alveoli to blood. So it's depend on the alveolar surface area, membrane thickness, and hemoglobin level, and pulmonary blood flow. These are the factors mainly affecting the DLCO. Okay, so I'll repeat again. So DLCO is mainly how well the oxygen passes from alveoli to blood. It will mainly depend on alveolar surface area, alveolar membranous thickness, and hemoglobin level, and pulmonary blood flow. So one of these will affected, it definitely DLCO will affected. Okay, KCO means gas transfer per alveoli. How efficient is each alveoli? Okay, alveoli efficient. Here we can see only alveoli efficient. So DLCO we are mainly measure the uh, oxygen diffusion capacity, how this alveoli function, how this uh, patient able to transfer the oxygen from uh, alveoli to blood. This is a indirect method. So I'll going to put the chart here. So this is a comparison chart with the reasons. So you can save this chart and save this and also share this to your friends. So here you can see each and every condition, what happened in the DLCO and what happened to the KCO and what are the reasons. So these are the common questions they are going to ask. For example, in asthma, what happened in the DLCO? So when you go through this chart, you can clearly answer. And also for an example, anemia, what happened? Definitely DLCO is reduced and KCO also reduced. So because of the reduced hemoglobin binding for carbon monoxide. So when you go through this chart, it's very easy. So please subscribe and share this with your friends, and we'll go for the I'll uh, I will discuss the another cases on part 2 in next video. So please subscribe and follow in my Facebook page as well as in the TikTok. Bye.